And hello and welcome to the webcast entitled COPD Awareness Month, Connecting with Social Support. We have just a few announcements before we begin. The slides will advance automatically throughout the presentation. To enlarge the slides, click the Enlarge Slides button located above your presentation window. Should you need technical assistance, click on the Help button. If your screen freezes or the slides do not appear to be advancing as they should, please try exiting and restarting the session, as it may be an issue with your connectivity. At any time, you can submit a question using the Ask a Question box located in the bottom left-hand corner of your screen. I will now turn the call over to Barbara Kaplan, MPH-CHES. Please go ahead, Barbara.
Thank you so much, and thank you everyone for joining our webcast today entitled COPD Awareness Month, Connecting People with Social Support. I wanted to let you know that this webcast is being recorded and will be available on our Lung Association YouTube channel. My name is Barbara Kaplan, and joining us today is Mark Courtney from the American Lung Association's Lung Helpline, and Carly Hamburger, who is the Manager of Adult Lung Health Education at the Lung Association. Today, we are going to hear from Mark about the relationship between social support and COPD. Then Carly's going to walk you through how to use the lung connection. And then I'm going to tell you a little bit about some of the other resources that we have available here at the American Lung Association. At the end, we'll have time for questions. If you have a question at any time, feel free to type it into the chat box on your screen, and we will address it at the end of the call. At this time, I'd like to introduce you to Mark Courtney, who is a respiratory therapist that works at the Lung Association's Helpline. Mark, thanks so much for being here.
Thanks, Barbara. Thanks for having me, and thanks for giving this opportunity to share some information with everybody. I'm a respiratory therapist. I work for the American Lung Association, actually for the Helpline, and we are a medical resource for folks out there with lung disease, lung questions, and all that. And I also am able to work part-time at a local hospital. So I feel like I benefit from both of my jobs. One will benefit the other because I have a little bit more knowledge base because of the work I do at the Helpline, and also I have a lot of hands-on from the work I do. And one of the patient populations that we see a lot of is the COPD patient, and I'm going to talk a little bit about the importance of social support. And for everybody, happy COPD Awareness Month. And really, I think that no matter who we're talking about, we definitely all need and benefit from social support. And why do we need social support? There's several ways, several things. One of them is depression. I mean, anybody that has been diagnosed with any kind of chronic lung disease or health issue, it's natural to have a little bit of depression, and we find that about 25% of COPD patients suffer from some clinical depression. Half of depressed people smoke, so we know there's a connection there. It may actually, the combination may actually work against a person when they're trying to quit tobacco. Depression makes it difficult to quit, and it can also lead to a worse health outcome. People tend to do worse both clinically and quality of life because of the depression. So we want to bring in things that will help this, and at the top of the list is support in pulmonary rehabilitation. Pulmonary rehabilitation can go a long way, and we'll talk about exactly what that is. The definition is basically a multitude of services directed at people with pulmonary disease, people and their families, with a goal of achieving and maintaining a maximum level of independence and function. And I think we can do that with pulmonary rehab and other support programs too. And as we add support, we know the more we add, depression and anxiety both go down. And anybody that's been diagnosed with any kind of a lung problem knows how anxiety can affect their life in a negative way. It can really affect their breathing in a negative way as well. So a little bit of support, knowledge, information can go a long way to reducing both of those. What feelings can social support help with? And these are some comments that we get a lot from people as far as guilt. I did this to myself. I don't want to burden others. So most people that are diagnosed with COPD are they're an important part of the family. Many of them are breadwinners. They're the household CEOs, and they wonder, how am I going to juggle everything I need to do in my life when I have to deal with this as well? The guilt part is, I did it to myself. I've been in medicine for 30 years, and I've never met a single person who deserves a lung disease. I think chronic tobacco use should be looked at as a health issue, just like COPD. So it's not something that you do to yourself necessarily. Nobody starts that bad habit and that addiction thinking that they're going to harm themselves. There's the embarrassment factor too. I'm not comfortable going out in public. People tell us that because they cough or they're using oxygen, people look at them differently. And those things, you kind of get a little bit of an isolation when that happens. Nobody understands. Even people in your own family might not understand what you're going through when you're dealing with this. And all of those feelings can kind of work against a person as far as, really taking this by the horns and dealing with this situation. This is a nice little thing that shows kind of everything that goes around that can improve a person's quality of life. You can increase sense of well-being if we can turn some of those thoughts of I did this to myself to I found a way that I can make positive changes in my life. If we can increase somebody's confidence, a little bit of knowledge, maybe a COPD action plan or something like that, so that the person that's going through this has some control over what they're doing, reduce guilt. You're doing everything you can for yourself and for people that are care about you and depend on you. And also it lowers the rate of depression. So by improving depression, we also can help people live longer as well. You really can't change the past, and I think that a lot of people that we see in support groups, that's one of the first things that they learn is, it starts here. You can't do anything to change what might have happened in the past, and sharing with someone who's on that same road will go a long way to understanding. And your doctor can tell you things about the disease. As a respiratory therapist, I can maybe give you some information and on that topic, but actually talking to somebody who is in that same situation, doing those same things that you're faced with, it definitely helps. Dealing with a chronic lung disease can be very stressful. When we get together with a group of people and we share our experiences, the disagreement part is normal, but the whole process should be positive. So if I'm sharing something that's maybe worked for me in the past or something like that, it might not apply to you, but the whole thing should be a positive note. When I was looking at some of the information, I did find a study that was done in Canada, and it was just released this month. And basically, they looked at a 20-mile radius around the hospital, and they identified COPD patients. They picked them randomly, and those people that they picked, they gave them hospital and home-based support, disease education, action plan for exacerbations, for sudden worsenings, and for dyspnea crisis when you just couldn't get your breath. They kind of told these folks exactly step by step what to do. They followed these patients for a year, and really what they found, just with that little bit of support and that information, the emergency room visits dropped by over half. Hospital admissions dropped by almost 70%, and the hospital stays were cut in half as well. They estimated a savings of about $750,000 just in this one-year pilot study on about 20 or 30 people. So you can imagine that, and in Canada, their cost per bed is different than ours. So we would expect to see a huge savings, and you take into account also the Medicare penalty for 30-day readmission, and you're looking at a savings that's even greater than that. So what options do we have for social support? There's a lot of different things. Pulmonary rehab. If you have not been to a pulmonary rehab program, I would strongly advise doing that. It's a great way. It's like an exercise program that includes a social aspect too. You are in there with a lot of other people. A lot of times, you're closely monitored by nurses, respiratory therapists, so they're not going to push you too far so that it puts you in danger in any way. They're real good about monitoring that, so it gives you some confidence that you can safely do those same things at home. Family is a great support, and I would advise that you bring as much family into the support as want to. Bring your spouse, bring children. They might get a new understanding of what you're going through just from a different perspective and finding out what's going on. Face-to-face support groups are very good at providing COPD patients and their families with support. We have Better Breathers clubs across the country. They're a great way to meet other people with similar issues. And these people, these groups share everything with from what's the best oxygen device to how to clean your nebulizers. I mean, all those things will come into play in the Better Breathers clubs, and they also often have guest speakers as well that help share more information. The Internet's a great place to get information as well. It's a great place to get some misinformation too. You kind of have to be careful what sites you're going to and what you're not, as far as trusting that information. And one of those things on the Internet that is we would like you to take advantage of, and we have a lot of our listeners have already taken advantage of it, is our Lung Connection community. And so now I'm going to turn things over to Carly Hamburger to show us exactly how to join this online community for people with lung disease. Carly?
Thanks so much, Mark. I'm going to be giving everyone a tour of the Lung Connection, which is our free online support community for people facing lung disease. And this community is open to anyone with lung disease, but by far our most active group of members are in the Living with COPD group. So to visit the Lung Connection, you just type in www.connection.lung.org, or you can Google the Lung Connection and it should pop up. So this is what the home page looks like, and in order to see the posts or post your own topic or communicate with other people, you'll need to register. And registration is simple, and to get started, you just click on the Register Now button on the right side. I put a little arrow next to it. If you've already registered, then you'll just need to log in. And you can do many things from the home page, like see current activities on the Lung Connection activities stream. But I would say make sure you write down your username and password so you don't forget it. And if you ever want to get back to the home page, simply just click on the Home button in the top left corner. So when you log in, you'll be taken to your profile page that will look something like this. And you can do many things from this page, like blog or add photos or respond to a discussion topic or manage your friends. But the first place I'd encourage you to go is to click on Profile on the left. And you can see the arrow is pointing to it. And if you ever want to come back to this page, just click on My Profile at the top. So once you're in your actual profile, you can change your information and settings. And I would encourage everyone to enter a nickname. So you can see the box is blown up a little bit on the right. After you enter your nickname, you want to be sure to check the box, only show my nickname. So that way when you're active on the Lung Connection, only your nickname will show and not your full name. And this is a great way to enhance your privacy. So while we're talking about privacy, I want to show you how you can adjust your account settings. So you simply click on Account Settings on the left, and you'll get to this page. And this is where you can decide who sees your profile. And a private profile is hidden from everyone, and the activity does not show up on the activity stream on the home page. So activities that appear on the home page are things like when you post a new topic or change your profile. A public profile means that anyone who joins the Lung Connection can see your profile, and all of your activities are published to the activity stream on the home page. So the setting where you can choose which activities appear on the activity stream is friend only. And that means someone has to request to be your friend, and you need to accept in order for them to see your profile. And with this setting, you can choose which activities show up on the activity stream on the home page by checking or unchecking those boxes. Most people choose friend only or public profile option. And I know that this might seem a little overwhelming right now, but if you get into your profile and you have any questions, feel free to email the administrator at lunggroupadmin@lung.org, and I'll show you another place where you can access the administrator. And you can also change your settings at any time by visiting your account setting page. So once you've registered and adjusted your account preferences, it's time to get started. So to post on the Lung Connection and see the full range of posts, you'll need to join a group. And you can do this by coming to the home page and clicking Groups and then selecting the one you want. And there's no limit to the number of groups you can join. Some users find it helpful to join all of the groups because often a lot of the same issues come up in each group. You can also click on Start a Discussion on the right, and it'll ask you which group you want to start the discussion in. And if you haven't joined that group, it'll prompt you to do so. So I'd like to draw your attention to the Click Here link that I've placed a star next to. If you have any technical questions or need any assistance, you can click there and send a note to the administrator who will respond to you as quickly as possible. So once you're in a group, you can post your own topic, you could read other posts, and you can respond to those posts. And to post a new topic, you just click Post a Topic. If you would like to be emailed every time someone posts in this group, which a lot of users choose to do, so they can keep in touch with everything that's going on, you just click on the subscribe button. And if you can unsubscribe at any time just by clicking that button one more time. So once you're ready to post a topic, you simply type what you want to say and hit Publish. And if you want to be emailed every time someone responds to your post, you can check the Subscribe to Receive Email Alerts box. So also, if you're curious about what any of those icons mean in the formatting box, like the little globe and the smiley face, if you just hover your mouse over the icon, it'll tell you what that means. And you can include links to websites, you can add pictures, you can change the font and the size, and all of that stuff using these buttons. If you want to find other users, you click on Find Others at the top. And this is one way to find people if you want to send them a private message or add them as a friend. So if you're not a person's friend, the Send Message link will say Add as Friend. And just to note that if your profile is public or friend only, you'll appear in this search so others can find you. But if your profile is set to private, you'll not appear in the search. So it might seem daunting at first, but once you spend a little time with this site, it's very easy to use. If you're looking for a discussion item on a certain topic, I invite you to search for that topic under Search Discussions on the group page, so right where that arrow is. So for example, if you search oxygen, it'll bring up all the posts written to date on that topic. And remember, you can also go back to the home page to find buttons for most everything you'll need. So if you ever have problems or questions, just remember the administrator is just a click away. I'm very happy to help you. So some people wonder what they should post about. and you can go on the Lung Connection to kind of get an idea of what people are talking about. But people talk about everything from oxygen to depression to side effects, or they just check in to see how each other are doing. And I've heard from some members that they feel bad for complaining or talking about their bad day, but really remember that everyone has days like that, and I can assure you that the people on the site can relate to you, and everyone is there to support each other. But there are some things that are not appropriate for the Lung Connection. And this is not a place to give or take medical advice, and every person should consult with their doctor about any medical issues. Also, don't post any sensitive personal information that you don't want to share with the community. You do have the opportunity to send private messages to users if you wish to discuss things one-on-one with somebody. Also, negative or inappropriate posts are not tolerated and will result in removal from the site. Lastly, this community is really all about support, so please refrain from promoting certain products or services on the site. So I'd just like to share with you some of the comments I've received about the Lung Connection that I really think speak to what it's all about. One user said, "You were all a great help and comfort to me during my recent illness. Thank you so much for your time and friendship. I would definitely recommend this site to anyone suffering with any lung disease." And another user said, "My experience with the Lung Connection has been wonderful for me. There are so many nice and helpful people on this site. It has helped me so much to know what to say to my doctor and ask the correct questions about my lungs and other issues I'm having. I've learned a lot about other people and their experiences, and this has better equipped me. I do know that some of the people on this site are there for you because they really do care." And then lastly, another member commented, "The site has provided me with a support network and valuable information." So we hope you'll join the Lung Connection and reap all the benefits it has to offer. And I think you'll find it very comforting to connect with a supportive community of people who are going through the same thing as you. So now I'm going to turn it over to Barbara Kaplan to talk a little bit more about some other great support resources we have at the American Lung Association. Barbara?
Thanks, Carly. All right, so I want to tell you a little bit about some of our tools, including the American Lung Association's Lung Helpline, which is a call center staffed by nurses and respiratory therapists like Mark, who can answer any of your questions about lung health. They offer smoking cessation. They have smoking cessation specialists. And the service is available from on Monday through Friday from 7 a.m. to 9 p.m. Central Standard Time. They offer free unlimited services that can be translated in over 150 languages. You can also chat with a counselor or submit a question online. This information is available on the homepage of the Lung Connection and on every group page as well. We also offer the My Fighting for Air community. It's an online caregiving coordination service where family, friends, and caregivers, colleagues, and neighbors can organize support of everyday tasks from simple house chores to weekly grocery trips. My Fighting for Air community is a free private online coordination service that includes an easy-to-use private group calendar specifically designed for organizing helpers who want to assist during times of need. And lastly, I want to talk a little bit about our Better Breathers Clubs. We offer this support group as an opportunity to learn ways to better cope with COPD while getting the support of others who share in the daily struggles of living with COPD. These support groups give you the tools you need to live the best quality of life you can. They are held in every state throughout the country, meet regularly, and feature educational presentations on a wide range of relevant topics. This is a great option if you want to attend an in-person support group, and you can visit our website to find a Better Breather Club near you. All right, so at this time, we would like to take questions related to social support and the Lung Connection. Simply type your questions in the chat box on your screen. We will respond to any questions, and any questions that we don't get to along with their answers, we're going to post on the Lung Connection, so be sure to check back there. As always, if you have a question about COPD or lung health and want to speak with a specialist, please call the Lung Help line at the information on your screen, or visit the site on the Lung Connection to follow the link to chat with a counselor. All right, so at this time we're going to take questions, so go ahead and begin typing your questions in now.
How about the ones about the lung function?
All right, we have our first question. Is the Lung Connection an English-only website? Carly?
Sure. Yes, at this time it is an English-only website, but I do want to say that we're always looking to improve our resources. So if you have any suggestions or any features you'd like to see on the Lung Connection, feel free to email the administrator. Thank you.
Great. And we've gotten a few questions regarding Better Breather Clubs and their availability across the country. Again, I would encourage you all to take a look at the website. In the Better Breather Club section, we have an area where you can search by your state, and you can identify a Better Breather Club near you. If you find that there may not be a Better Breather Club that is nearby, you can certainly reach out to your local lung association office. There may be opportunities to start one near you, especially if you are a healthcare provider or know of a healthcare provider who may be willing to help put together a support group and become a facilitator. So we'd be happy to help figure out ways to support you. All right. Mark, we've gotten a few questions regarding COPD, living with COPD, and high altitude. Would you feel comfortable answering that question?
Yeah, absolutely. And it's kind of ironic because one of probably the physician that has the most responsibility for bringing supplemental oxygen treatment to COPD patients is a doctor by the name of Thomas Petty, and he actually lived in Denver. So one of his first writings when he was getting into this, he actually would take a bottle of oxygen with him up to the higher altitudes where he liked to fish, and found that it was much easier moving around, and that kind of spurred on everything else, and pretty much all of the data that we have right now to show that oxygen helps COPD patients is from a lot of his research that Dr. Petty did. And, I don't think it's, in most of the areas of the country, it's not that big a deal. Sometimes there are some higher altitudes. When you get up over 5,000 or 6,000 feet and higher, then you might see a little bit of difference. It may mean that if you're already on oxygen and you plan to visit a place like that, you might need to turn the oxygen up a little bit. I think probably the best thing to do for anybody is to have their own portable pulse oximeter. That kind of tells us exactly where you stand as far as the oxygen and whether or not it's something you need to worry about. We get questions at the helpline all the time about that, or about flying on an airplane with oxygen, because actually, I don't think a lot of people realize this, but the airplanes, even though they're pressurized, they don't pressurize all the way back down to sea level. they keep you at about 8,000 feet above sea level. So for some COPD patients that are right on the border of needing oxygen, they may actually need oxygen in flight. So that's something to think about. I think there is a little bit of a difference, but it's probably not going to make that much of a difference one way or another. You're not going to feel a whole lot better by moving to sea level because there are other things you have to consider as well that can affect your COPD, but it does make a little bit of a difference.
Thanks so much, Mark. Carly, I have a few questions coming your way. There's been a question about how long has the lung connection been available? And also, if you could answer, there was a question about how old, is there an age limit to participate in the lung connection? 18 years or older?
Yes, you do have to be 18 years or older to register for the lung connection. As far as how long it's been around for a couple of years, and then recently, over the past 6 or 7 months, we did some revamping, so it has a brand new look and it's become a lot more active. So for about the past 7 months, it's really started to grow into a great community, and it's growing every day.
Thanks, Carly. Okay, Mark, I have another question directed for you. We have a question around how can I get people in pulmonary rehab more interested in joining a COPD support group?
Well, the Better Breathers program that I'm most familiar with in this area, they're also the same people that do the pulmonary rehab. So I think it's important that you have to kind of be there with the pulmonary rehab and maybe make contact with those patients at that time. And I guess just be flexible about meeting times and things like that. We kind of run across the gamut of people. Some people are working age. They don't have time at 1 in the afternoon or something like that. So it might be better to be flexible with the times. Definitely take advantage of the Lung Connection website as well, and maybe you can reach some people in your area that way. Most people are more than willing. I haven't had too many people that have said that they're benefiting from pulmonary rehab. They will benefit just as much from the Better Breathers clubs. I think it's just a matter of reaching people and tell them that you're available.
Thanks so much, Mark. Just as a reminder, these slides, or actually this webcast is being recorded, so we will make this presentation available for those who may want to review the information again or provide a link to someone who was not able to participate today. We are getting a few medical questions, and I would like to, if you do have a medical question, I would recommend calling the lung helpline at the information on the screen. They certainly can help with those questions. We also will be posting some answers to questions that we won't be able to get to today in the Lung Connection. So be sure to join us there, continue the conversation. There was one other question that came in around opportunities to talk about federal legislation on lung disease issues in the Lung Connection. And the Lung Connection really is reserved for social support. So we do have an opportunity for people who want to get involved in federal legislation. And I would invite you all to join our Lung Action Network. And that you can find on our website. All right.
This is Carly, and I just saw some questions that maybe Mark can answer about the helpline, about who is the helpline for, who is it open to, and when someone calls, if they call multiple times, do they have to keep re-explaining their story, or is an account set up? I thought that would be good to go over, Mark.
Yeah, absolutely, and it's kind of neat the way our software work. I mean, people, if they want to remain anonymous, they can. The only thing that we ask for is a zip code because that helps us track where our calls are coming from, and we have a caller ID set up on our system. So when a call comes in, whoever's not on the line at the time, that will ring to that person, so you can get a different person when you call or the same person. And you know, we would like to talk to the same people, you know, if they're wanting to. But it's good to get a different perspective from some of the other professionals. We have, you know, 100 years worth of experience in the medical field here at the helpline. So basically, if you had called before, and you're calling again, your file will pop up on my screen as I answer the phone, so I kind of know who's calling and what they've talked about before. If you're calling, you know, to follow something up, then we'll kind of know where it is. So it really saves time, kind of makes the process a little more seamless, and we get right to where it's going. We also offer tobacco cessation counseling to anybody in the country as well. It's all free of charge, information, support, and that as well. With our addiction counselors, we also have nurses and respiratory therapists that do that as well. But the nurses and respiratory therapists would be here to answer any medical questions that people might have. And we do a lot of research. A common response from me is, well, nothing comes right to mind, but I would be happy to research it for you. And we have just so many different resources that we can use to help find things that maybe somebody can't find even on the internet. So we definitely would like that opportunity to help those people.
And just for those of you that can't see the slides, the helpline number is 1-800-LUNG-USA or 1-800-586-4872. You can also visit www.lunghelpline.org.
Great. All right. Well,
I see a question for Mark, Barbara.
Yeah, sure.
One question. Someone was wondering, what's the criteria you have to meet to qualify for pulmonary rehabilitation? I think that's a good question.
Yeah, and it is covered under most insurances and Medicare. I believe that you have to meet certain requirements as far as your pulmonary function test goes and your level of ability. Different insurances will pay for different amount of visits. So if you're not seeing a lung specialist, that would be a good idea, because that lung specialist would put you in touch with that program as soon as you would qualify. They usually want to see people with moderate to severe lung disease, not people right at the very early stages, although we'd love to be able to diagnose people earlier stages. Unfortunately, most of the people we see are already in the moderate stage, so most of them would qualify for some kind of pulmonary rehabilitation. I think with all the changes that are coming here very soon in the health care, that's going to open up a whole nother window of people that are going to benefit from this.
Thanks so much, Mark. All right. Well, it looks like we do have several questions pertaining to, medical treatment of COPD, and I think we'll move that conversation to our lung cancer, our lung connection community. So please be sure to join us there. And I think that will wrap up the Q&A for today. Thank you, everyone, for calling in and participating. We got some great questions.
Thank you.
And thank you, ladies and gentlemen. This concludes today's webcast. Thank you for participating. You may now disconnect.